Protein supplementation for renal care patients. Protein supplementation for renal care patients might, at first glance, appear irrelevant. Especially since the kidneys, to most people, are more for clearing out the impurities in the blood rather than proteins. However, an understanding of how the kidneys work might enable you to understand why protein supplements might be of benefit in the case of kidney problems or even complete renal failure. Most people know that their kidneys are responsible for producing urine that is passed to the bladder for storage prior to the urination that is triggered by pressure on the bladder. However, if you suffer, or have suffered from, kidney problems, you might have a better appreciation of how the kidneys affect the protein in the blood. This is particularly true if your renal care involves dialysis, because of complete renal failure. In addition to removing blood impurities, one particular function of the kidneys is to allow proteins to remain in the blood. The kidneys actively prevent blood protein from being passed through the urine. The impact this has on the need for protein supplementation is that impaired kidneys can fail to carry out this function. Keep in mind that their kidneys are active in enabling proteins to remain in blood circulation, rather than being passed as waste. What that means is that the proteins would be extracted into the urine if the kidneys did not actively prevent it. So, faulty kidneys can allow the blood protein to be lost. Additionally, amino acids, the metabolism extracts from proteins, are lost and not used by your body. Amino acids are essential in creating new proteins which enable your body's biochemistry to maintain life. If you lose too much of your blood proteins, you could become extremely ill. This is one of the reasons why kidney failure is so serious, not just because your blood is not properly filtered of impurities, but also because of the potential loss of protein. Thus, if you suffer from kidney problems and are a renal care patient, you should take protein concentrates. The protein needs of renal care patients, particularly those on dialysis, are enormous. Many doctors would recommend that you take at least 2 grams of protein per kilogram of your ideal weight, not your actual weight, but your ideal weight. This should be done without any of the fluid retention that kidney problems can cause. So if your ideal weight is 11 stone, or 70 kilograms, you should take 140 g protein each day. The easiest way to take this is in the form of concentrated protein supplements. In a form that is easily assimilated into your body. Keep in mind that this does not mean 140 g of chicken, but of raw protein, without the water, fat, or carbohydrate content. Naturally this is not cut and dry, but knowing this, you should easily be able to meet your protein needs. Because many dialysis patients have difficulty retaining a normal diet, a palatable protein supplement makes it easier for the patient's body to assimilate and retain important nutrients and proteins. Well-formulated protein supplementation will provide you with protein in a form that is easily converted into amino acids, unlike some foodstuffs that do not already contain the amino acids needed to help process the proteins that renal care patients require for their good health.